We'd all love to look 10 years younger, that's for sure. Through the new state-of-the-art technologies, turning back the clock is getting more accessible than ever.
And the best part is, as the procedures get better and better, the recovery time is less and less. No more slipping up of sight for 6 weeks until all the healing is done. And back with us today to talk about some of the exciting new options is Dr. Michael Jasin from the Jasin Facial Rejuvenation Center. Good morning, sir.
Good morning. How are you?
Good, thank you. So we joked about this the other day, that back in the old days of facial rejuvenation and cosmetic surgery, you were like Claude Rains. You had to go away to Scottsdale for a week and wrap your face in bandages, and now it's really easy.
Well, we've got a lot of no downtime choices, and we'll talk about some things today with facelifting that we can have a recovery in as little as a weekend.
And you just got back from one of these new injectable fillers. Speaking on that, you're in this Radiesse, this World Council in Austria.
It was very nice. It was quite an ordeal to get over there, but it was nice once we got there. And I happened to be one of the featured speakers to talk about Radiesse, which is a semi-permanent filler that we have lasting in the range of 1 to 2 years. And there was a select group of 90 doctors invited from around the world, literally. And it was nice to talk to them about my technique, which is a little bit more unique, because we're entering a new dawn in what we can offer with injectable fillers, whereas we used to just treat lines and wrinkles and plump up areas. Now we're using fillers to more recontour the face and do some reshaping of the face. And my technique is a little different in that I'm injecting it below the tissues on top of the bone versus just filling it with inside the skin to try to hide something.
More topical. And Radiesse is, and what is it exactly?
Well, it's made of calcium hydroxylapatite, which may not mean much to you, but it's the same mineral that's in your bones and your teeth. So it's a naturally occurring substance without the potential for an allergic reaction, which makes it nice. So there's no skin testing needed. On average, it's about 1 to 2 years of duration before you need to touch up. And because it's a more durable product, we can place it in different locations, like on top of the bone, and have it act like an implant. So we've been using it a lot now for cheek flattening. As we age, this lower part of the cheek right below the eyeball tends to get flat, the lower lid tends to lengthen. So if we fill that, we give support to the tissues, because that fat pad that used to be up here drops down here, and then these folds start to form like I've got.
Well, like we've all got, and some of us a little younger than you, and you want to keep up that young appearance. And you look great. I'm not just saying. But
10 years worth of Botox helps.
Well, and you use this with, you said with Botox, or with, you can use this with other injectables.
Absolutely. It's not an either-or situation, and a lot of times Botox will complement a filler. If we're trying to fill an area where there's a lot of animation, such as possibly a lip, or in particular the frown lines and furrows between the brows, we find that relaxing the muscle makes the filler do a better job initially, but also adds more longevity to the product, because we don't have the muscle trying to work that filler out of there. So they complement each other.
Well, you have so many techniques that are almost either non-surgical or minimally invasive, and you use them in combination. What is the, or what are your procedures, and how are you using this in combination to personalize someone's treatments?
Well, the exciting thing that's going on now is we're trying to combine some of our non-surgical modalities with our surgical procedures that we do to minimize downtime for the patient, yet maximize results and maintain a natural appearance. One of the main things our patients are concerned about when they come in is looking unnatural or looking like somebody else when they get done. In this way, we can be a little more subtle, but produce some truly amazing results, as we'll see, I think, when we look through the
Yeah, you have some pictures here that we were looking at, actually, we're going to put on the screen, and we were looking at this morning, and they're great, because it's just not, it's a difference, but it's not that a drastic difference to where it looks.
This patient just had filler. She had Radiesse to fill the cheeks, a little bit of the area called the tear trough, or the crease below the lower lid, and also a little bit of filling of the lips. And you can see she has a lift effect without ever doing a lift. And she actually came back subsequently and had a lift to get a little more correction.
Well, and we talk about a natural look, and I hope she doesn't mind us picking her apart, but she does look 10 years younger, and it does look natural. It looks very natural.
It doesn't look fake, yeah.
That's the goal of today's aesthetic patient.
And this is really neat, because it looks like she's aged gracefully. She looks younger, but it looks like even that younger appearance has been a graceful aging process.
Right. And what we've done here is combine our 1 hour Simplicity facelift with Simplicity neck lift and filling around the mouth to enhance the results that we get with the lift. This way, we're not trying to overdo the surgical procedure. We can back off a little bit and keep that natural appearance, not looking stretched, but augment in areas where we need to fill and add volume in areas where we used to have it, but we've lost it.
And talk about the Simplicity lift while we're looking at these pictures a
and
little bit.
this patient also is a 71-year-old. She had a Simplicity lift.
Wow.
Along with some liposuction of the jowls and neck, which are one-stitch incision procedures. You can heal from this in as little as a weekend.
Wow.
Simplicity lift. But we've added some volume at the corners of the mouth and along the jawline. And again, here, we see the Simplicity lift along with filling to enhance the results that we see. So we've tightened the tissues, but now we're going to recontour with the Radiesse in addition to that to maximize the results. And you see the fuller cheekbones, the better jawline, less tired look, but yet looking very, very natural.
Look at that face right there.
That's the type of result we're trying to achieve with this combination effect.
Well, look around the lower laugh lines there along the outside of the edge of the mouth and along the neck. That woman in the cheekbones really was, we talk about not being drastic. That wasn't drastic in an unnatural way. That was startling how much youth you brought back to that area of the face.
And that's what we try to do consistently with our results. And the procedures that we use, the Simplicity lift, the 1-hour facelift, can be done under local anesthesia. And as I mentioned, recovered as little as a weekend. It's done in the office. And we try to use procedures that are going to work. There's a lot of things out there for patients. They hear about thread lifts and they hear about various lasers, things that don't give the consistency that we'd like to see. So we try to use a little bit more in the way of proven surgical principles being applied with the idea that we want to make things as simple as we can for the patient. So when we say Simplicity lift or Simplicity neck lift, what we're trying to do is make it as simple as we can for the patient so their recovery is as easy as possible, minimal downtime. Simplicity may mean more work for me in some cases, but yet it makes it simpler for the patient. And if we do what's best for the patient, then we tend to all come out ahead.
And you showed us something a little earlier. You're world renowned with the Radiesse, one of a few doctors invited to a conference from across the world, even fewer invited to speak on your groundbreaking techniques. You've got something pretty nifty. You want to show us this? Do you want to break this out a little bit?
Sure. This is something we'll talk more about the next time I'm on the show.
Next time.
We'll talk about the new horizons of facial cosmetic surgery. But we do injectable fillers for lips. Sometimes people want something with more longevity and more sustenance. So we have now an inflatable lip implant, and I'm the first one in Florida to have used this. We've done it now and placed about 10 implants. And it's inflatable with saline, just like a breast implant would be. But the nice thing is, with this implant, rather than being hard and solid, if you touch it, it's kind of springy and spongy, so it feels
very
natural.
Soft.
And it can be placed in an upper and lower lip in 15 to 30 minutes.
It's very natural.
It's really nice for those people who want something that's longer duration than what an injectable would be.
Absolutely. And we're running out of time, so we quickly would like to talk about your seminar coming up in Lakeland.
Great.
So that people can get out and see you. And that's going to be February 24th at 10 a.m. Simple ways to rejuvenate your face. Imperial Swan Hotel, Lakeland. And if you want more information, you can call 888-815-3223 or jasonfacial.com to get more information. And then we're going to talk about this next time you're back, right?
I'll look forward to it.
Absolutely. Thank you so much.
Dr. Michael Jasin, nice to see you again. I love your work.
Thank you. I appreciate it.
See you around Sarasota.